You've decided you're ready to become a parent, and suddenly you're overwhelmed with people who feel they have the right to inform you on the correct way to conceive, give birth, what fears you should have, and the proper way to parent. How do you filter through the opinions? How do you know what's trustworthy information and what's a myth or just plain outdated? Welcome to the Birth Ease podcast. Join your host Michelle Smith and her guests as they cut through the noise and fear by sharing valuable tips, tools, and proven methods that help you connect with your own inner wisdom as you navigate the sacred journey that is pregnancy, birth, and parenthood in a more relaxed and confident manner. This podcast does not constitute, nor is it intended, as medical advice.
Hello, Birth Ease families. Welcome to this heartfelt space. These days, it seems as if there is so much noise and stress surrounding pregnancy, birth, and parenthood. My purpose with each episode in this series has been to address the fears and the anxiety you may be feeling and provide resources to help reduce it. Today, I am incredibly grateful and honored to have with me Dr. Lyndsey Sutherland. Dr. Sutherland is a passionate mother and advocate for healthy families. She is both a professor at the University of Central Florida and an entrepreneur working hard to empower families on their journey to live happy and full lives. Lyndsey is a family nurse practitioner who received her Doctor of Nursing Practice from the University of Central Florida with honors. In her practice, she focuses on prevention and education, which are the building blocks to maintain and establish health. She works closely with a network of medical professionals to find the root cause of illness for her patients and not just treat their symptoms. Lyndsey believes in you. She believes in your children. She knows you were made for this and that together we will not just survive parenthood, but thrive as mothers and fathers of the children we love so much. Welcome, Lyndsey, to the Birth Ease podcast. I'm so excited you're here.
Thank you, Michelle.
So I love the ending of your bio. That just speaks volumes about who you are and how you work with families. And could you just share with the listeners what drove you to become a pediatric provider and how your philosophy was shaped?
Well, believe it or not, when I was in nursing school, I had said I would do anything else but work with children.
Oh.
And I largely attributed that to, so as a nurse, you spend a lot of time in a hospital, and any pediatric exposure that I had in a hospital, it was just get them well and get them out the door, and it missed the relationship part. Mm-hmm. And I didn't know that you could have a relationship outside of the hospital. And that's when I became a nurse practitioner. I saw this whole other world as an outpatient provider. But I had said for so long that I didn't want to work with children that when I actually did my pediatric rotation, I was like, what is this? I think I actually like this. What am I supposed to do? And God just made it super clear that this is who you're supposed to work with. This is the voice you're supposed to be for these kids. And I can't see myself doing anything else now. So that's how I started working with children. The holistic spin that I've incorporated, really, I'll go backwards a lot. So I really feel that a lot is attributed to my mom. I'm in my mid-30s, and so everything we did was organic, grass-fed, and that was well before that was popular. We were made fun of a lot. My parents grew up in Massachusetts, so they didn't call things smoothies. They called things fraps. And so we would have our morning green frap in the morning, and honest to goodness, I don't even know what was in it half the time because the color of blueberries would just cover over everything. But she would put in things that she was researching. So if she was researching about, we're in a time period of testing, we need our brain to be functioning at its optimal level, she would add in powders and oils and all sorts of things to help us with that. And so I knew this world existed, and I would see that my mom would largely go to the health food store and just find something and incorporate it with what was going on, either symptoms my sister and I were having or something she researched that resonated well with her that we needed. And then I went to Stetson University, and My degree is in integrative health science. And so that was really the beginning foundation with a research backing of why this is important and why this should be incorporated into lives if it resonates with us or with that person. That was a great foundation. So it was pure introduction to homeopathy, to Chinese medicine, to different herbaceuticals, botanicals. And so for me, it was great to see, wow, there is evidence and there's research backing that this does work and that this could be integrated in. What I didn't know with that degree was you either taught with it or it was a building block to continue on. And so that's when I decided I wanted to be a nurse practitioner. So I went back to school to be a nurse. And while I was in after nursing school, I worked for a physician in town, Dr. Kalidas, at the Center for Natural and Integrative Medicine. And for me, it was truly inspiring and it was just amazing to see this whole world where you could truly integrate Western and Eastern practices. He's a medical doctor and naturopathic doctor. And so to see people travel globally, that they want this and that it works was just really awesome, really awesome. So I worked there for quite some time. And then after I became a nurse practitioner, I worked in pediatrics. And so I worked at the Fran Center and continued to gain, just adding more things to my resource bank and seeing proof that this works. And then God laid it on my heart to do my own practice. And so currently I still integrate Eastern and Western practices. I am grateful for my Western training. It is important to know there's times where we have to draw the line and say, okay, we gave it our best shot. And now we're teetering into an area where I'm grateful we have Western stuff. And so that's where I love is just, I have both, and I like knowing where I can dive full force into something, and at other times knowing, okay, we did our best and now we need to use what Western medicine has to offer. Most of the time, though, it's integrating both simultaneously.
I think that's where the real power of it is taking the best of both worlds, whether that's in pregnancy, just your own health as an adult, or caring for your children. Because I don't think it has to be so polarized. Only holistic, only medical.
Sure.
I like it when it's a more complementary approach. I think that's really valuable. So could you share with the listeners what they would want to look for in a pediatric provider?
What families should look for is someone that they resonate with and someone who is willing to hold their hand and have a relationship with them as they go through this period of raising children. So often I meet families who just are afraid. Truly, it's fear. They are afraid to share what they are doing in their home. And I let families know from day one, if we are not in a trusting relationship, I'm also going to have a hard time knowing what I can share and what they may actually be looking for. For example, if I have a kid who has constipation, for example, and I am recommending magnesium, and little do I know the family's like, oh, absolutely not. We will absolutely not do magnesium. Then I'm leaving our conversation that day thinking, great, this kid's going to be pooping. He's going to be feeling so much better. But if that's something that the family has, for whatever reason, decided that's not something they want to do, we're not getting to the main goal, which is having this kid poop, which is hugely important. And so I feel like it really comes down to relationship, being in a trusting relationship for both of us. And I love when families, you can just see things melt when I start to share what I do personally with my kids. And it's almost as if you just see this veil lifted, and the family usually takes a big, deep breath. And they're like, oh my gosh, this is so nice to find someone who is not going to judge me or kick me out of their practice or think I'm crazy. I mean, I've heard lots of unfortunate things. And do I always agree with what a family wants to do? Not always, but as long as it's not going to hurt their child and as long as there's parameters around it, I feel the family and I have a good understanding of what is best for their child. For example, I had a family who recently, the cough was really worrisome to me. I didn't hear pneumonia. The pulse ox was fine. And so it was a conversation of, hey, if this starts to happen and if this starts to happen, we have truly done as much as we can do with what we're doing. Now we need to move on to this treatment protocol. And it was great. I heard from the family this weekend and they said, hey, we've started to hit 2 of the 3 things that you wanted us to look for. We're ready to move to what you were talking about on Friday. And that is what needs to happen, where families know what to look for and just how they can best gauge their child.
Yeah, and I think it's important to have a relationship with your pediatric provider that you feel, essentially what you were expressing is that they feel safe, that you feel safe with your provider to really explain how you want to parent, what you value as a parent, and how you want to care for your child. And maybe you love essential oils. Maybe you like to use homeopathy or more holistic practices. Or perhaps you are a more medically minded parent, and so you want a caregiver that's going to practice in that model. I think it gets into also finding a provider that shares similar values.
Mm-hmm. Absolutely.
In parenting and how you want to raise your child, or in pregnancy, how you want to give birth.
Mm-hmm.
Because when your child's sick, oh, this is my pediatrician that I trust.
Right.
And have that more, what's the word I want? Because part of your practice is very specific too. It's more of a hands-on approach and not that rushed medical model that we're so much a part of these days.
Right.
And I think that's missing in a lot of our care, but that's how our system is. So could you outline how this more holistic approach would work? What if you had a new family that is not familiar with some of this? How would that work? But they heard great things about you and they want that more almost intimate relationship with their pediatrician that really knows them and knows their child.
Even just going a little bit more of what you were saying, when I was in clinicals, these visits are about 15 minutes. My visits are anywhere from 30 to 45, and even within that, I still think I could use more time to really get to know a child and a family. I have office and home visit options, and some of my favorites actually are in the home because when I look around, I can see the child's artwork, or I can see the setup within the house. I can just see so much more. Families tend to be more comfortable, obviously, in their own house. But even still in the office, I really try to send a message of comfort. There's a homey rug in the room, and I'm shocked how many families comment about it. It's not your white wall, sterile building that we're so used to. For a new family who would be moving over to this model, a lot has to do with focusing on the root of things. So for example, going back to that constipated kid, yes, magnesium will work, but why? Why is this kid constipated? Is it what he's eating? Is it a bacteria in his gut that's causing it? Is it a misalignment where chiropractic care or craniosacral needs to be integrated? Is it an emotional response? And we need to actually look at an emotional perspective. And so that's how my brain works. It's not just what's the problem and what's the treatment for it. It's, okay, what is the problem? But what are all the different potential components that could be contributing to this? And teasing out what are all the tools in the toolbox and what is it more specific for what's going on with this individual. And so that's from that perspective. Of course, with well visits, I'm still looking at milestones. If there are delays, or if you're just on that line of, oh, we should be a little bit further along. It's not waiting until there's a problem and then having to pick up the pieces. It's being proactive of, hey, I'm not worried about this right now, but let's get this started to help little Johnny get more on track and stay ahead of schedule. And really, it's taking the time to get to know that individual. I truly feel it's impossible to get to know someone in 10 or 15 minutes.
Yeah, I agree. That's part of why I've always taught my classes on a one-on-one basis, because I like that model of getting to know who I'm supporting, who I'm educating, where are you giving birth, How do you want to give birth? Do you have any stress or trauma going on right now? It's such a more holistic picture, which it sounds like in your practice, you are really treating the whole child. You're supporting the whole family,
Right.
not just a symptom.
And when I first started, when I was a nurse practitioner, I didn't have kids yet. And I think back to all those families at the beginning that I would ask just what I read in the textbook of what should be happening. And if you're out there, I am so sorry because now as a parent, kids don't read the textbook and it doesn't work in this picture black and white thing that, of course, we all would love. And so just having that now, to be able to hold a mom's hand and cry along with her because I know what it feels like to live on 2 hours of sleep while your kid is teething, or because you have a colicky baby, or, fill in the blank for whatever's going on. I may not have the exact same, but just being able to connect mom to mom, to lock eyes and to say, I get it, I've been there, and I'm proof that we will get through it. I love that bond. I love it.
It makes a big difference. And I was laughing as you were saying that because I always say when I'm teaching, uteruses and babies don't read textbooks. Like here's the parameters of how your labor may go, but we don't know exactly because each person is individual. And it sounds like you're really embracing that. It transfers in that care and helping the family to feel supported, especially if this is your first baby. Mm-hmm. You haven't done this before. And I feel like we're in a really interesting time where it's so wonderful because there's so much information and we can find so much information. And at the same time, there is almost information overload and this strange dichotomy of families, mothers, parents, fathers. We're not trusting ourselves anymore. Does that make any sense?
Yes. Yeah, it does. Someone had once asked me what would be my pearl of advice for families, and it truly is just tapping back into, and I'll speak to moms because I am a mom, but it's tapping back into, we really do know what to do, and to trust your instincts because down deep, we can find it again. Down deep, it exists, it is there. Sometimes I work with families who are from other cultures, and I can see a difference where they are used to multi-generationally living under one household. And so you're seeing, you're seeing like the family bed. Mm-hmm. You're seeing grandparents having input because everyone is there to support. And so when you look at our current society, not only are we not under one roof, we are often across the globe from each other. And so we're not seeing what was it like when Aunt Sally had little Johnny, and what did that look like, and how did she do things? And so sometimes I'm asked questions where I will pause and I'll ask the parent, I'll look to the mom and say, do you know what you want to do? And it's so freeing to see the glimmer in her eye because she does, but she's combating what Google is saying, what her friends are saying, what her mother-in-law is saying. But the truth is, she does know. And so it's just to give space and to honor that mom to share what she does want to do. And I find that the honesty and the vulnerability is able to come out when someone just pauses and says, hey, what do you want to do? Because that's what matters at the end of the day. What does that family want to do? Because it is different for each family.
I agree. What are your values as a family?
Mm-hmm.
What's important to you? How do you want to raise your children? And again, there's that dichotomy in what you're saying that we don't live in multi-generational homes. And so we don't get the value of that. And at the same time, sometimes in families, moms are crying either in their pregnancy or postpartum or as they're parenting because their family or friends are being really overbearing.
Right.
And it's learning to find our own inner wisdom, which has been an undercurrent in this podcast since it began, as I interview different experts in their fields, and trusting our baby, because you really do know your baby better than anyone. And in lieu to what you were just saying, if you're seeing a child in a traditional pediatric practice, how can they really know your child if they're only seeing your child for 15 minutes?
Really, I don't know what it is about family members, but it tends to be more family members that like to butt in and share their opinions as well. And it isn't just that. It's, you've had 4 ear infections and you're on your 4th one, and now we're talking about tubes and having to do shots of Versephin. And as that parent, something in their gut is saying something is just not right. And so it's talking to someone who is going to step back and say, well, what's your diet like? Are your ears actually infected, or is it fluid? Do we need to get a chiropractor and craniosacral therapist on board to help release that fluid? What about different homeopathics that could help? But that first step is that parent coming in and just saying something is not right. And that's really all I need that's what I love. I love hearing that. You don't even have to know what to do. It's just that first step of knowing in your gut, something is not right. I really feel there's another option out there. Where is it and what is it? That's where I like to come in and help that family navigate what could be the other options.
And it's about finding a caregiver that's going to listen to you. And that, again, it's building that relationship. I think it's so important. So something that I'd like to touch on that I'm finding just as a doula and working with families and as a childbirth educator is that many times parents, it's almost like they're being bullied or shamed, either during their pregnancy or when they work with their pediatrician. And I have very strong feelings about it because I don't want to say it's appalling. It's appalling to me. And is it something that you've witnessed in your practice, and do you have any suggestions surrounding it?
I often hear stories that families will share with me, yes, of being shamed and bullied or just not being listened to, which sends a message as well. And yeah, it is really appalling. And for me, it was stepping away from that model and being in this one where a lot of the discussion within the visit is reassuring families that they know their child the best. They're with them all the time. And so if I have someone say, hey, my kid's temperature naturally runs low, and at 99, that's actually a fever for them, I'm not going to go back and say, no, here in the textbook, a fever is 100.4 rectally. You're wrong. I would never do that. That's a light example, but take that on a larger scale, and that's what's happening. And it's not okay. Yeah,
well, I think it adds to that pervasive problem of we can't trust ourselves. We can't trust our parenting instincts because there's an authority out there that knows more than us. Right. And I'm not saying that we don't need to learn, that we don't need to educate ourselves, or we need to reach out to our medical providers, of course, when we have a problem, or just understanding child development. All of that is so important. But we also need to be treated with respect. And as a new parent, because sometimes there's this, oh, she's a new parent. You know how they are. And of course you're scared. You haven't done it before. But maybe if our culture was teaching new parents that, yes, there's going to be things that you don't understand, that you haven't experienced, let us help you and support you. It's almost like you prepare to have the baby. You do all this stuff, and then the baby's here, and then you don't know what to do. And I don't know, I'm kind of contradicting myself, but how do we find that balance of, it's discernment of I can trust myself and there's resources out there to help me in the things that I am uneducated about or I'm unsure of. Am I making any sense at all?
Yeah. And where I feel a parent should be supported is with a provider who is going to put their hand on their shoulder and say, you know what you're doing, trust yourself. because that is the truth. They do know.
So, what are the impacts of the way our medical system is on our families? Are you seeing any of that because you do take this more holistic approach?
So, great question. I didn't know how to ask what I was seeing until recently. And perhaps that might be in researching more currently of the perinatal period. So that time of pregnancy is so important. In my world, I am seeing the baby once they're born. And so in school, my training, it's that newborn on up. But really, I'm honing more into the time period of when a mom is pregnant and asking this question of what was your pregnancy like? And I have been floored by the responses. Anything from a provider shutting a mom down and not valuing what she wanted. What I'm seeing is trauma. And it can manifest in children in all sorts of ways. Eczema, bonding issues, feeding problems, an anxious baby. And so really, in a perfect world, I would love to get with moms who haven't had their baby yet.
Really to help mitigate that stress.
Right.
Because it impacts the baby and it impacts the way their brain develops, research is finding.
I was at first asking any trauma during your pregnancy, and often the answer would be no. But what we don't think about with trauma is actually a stress, and it could be a good stress and a negative stress. And once I started asking moms, what was your pregnancy like? Then that changed the tune of the conversation. And that's what I mean by I was floored. I was shocked with how much stress a mom actually had, what they went through during pregnancy. And it could even be death of a family member or a friend. It could be a move. It could be job components. But what I wasn't thinking about was how was their voice shut down while they were pregnant with the provider that they were seeing.
Wow. That's so true. It's true.
So it's more than what I was at first thinking about. And that's where the change of question really was beneficial. Or it was a birth plan that needed to change for the health of the baby or the mom. But what I share with, in particular, moms, when they share with me what happened during pregnancy, it's to go back and to address that. Not to think, oh, that part's over. Now the baby's here. We have to go back and address it.
So what ways do you recommend addressing that? Because babies can incur trauma during the birth as well. Mm-hmm. And how do you suggest resolving that?
Well, that can be anything from, it really depends what happened. And so that could be, I love your line of work, Michelle, because that is largely important of actually going back and talking to someone who has experienced with trauma. And so that could be through hypnosis. That could be working with a mind-body specialist of another capacity and releasing those emotions. It could be craniosacral. I have seen where craniosacral can be quite helpful. But largely, it's letting a mom know this is very important. As a mom, I'm guilty of this too. It's like, oh, I'll do whatever it takes for my kid. And I put myself on the back burner. Yes. But that cannot happen because trauma is real, emotions are real, and they can get deep-seated and rooted, and they will rear its ugly head. And goodness, can be passed down generationally. Like there's just, yes. That's a whole nother podcast, Michelle.
Yes, we are going to do a whole other podcast on that.
But yes, from what I see, I can see anxious moms, which make anxious babies. And so to reverse that really just makes a huge impact.
Right. But I feel like there's such a energy of fear in our culture. Mm-hmm. Like our children aren't even allowed to go outside and play. Mm-hmm. I heard the story of a mom who let her 8 and 10-year-old go to the park across the street by themselves, and somebody called Department of Children and Families on them. Mm. And when I was 8 and 10, and we were out on our bikes, you're outside, you go play. And I think our culture is creating this environment where our children don't even feel safe in the world. And look at the shootings that are going on in the schools and there's so much information overload and lack of feeling safe. I don't know if I'm articulating this well because it's such a complicated issue, but I think it distills back down to that trusting ourselves, trusting our children, helping them to trust their gut that, oh, this situation doesn't feel safe.
Right.
I don't know if I feel safe with this person. We need to teach them those parameters of stranger danger. But I've also seen situations where children are afraid to talk to anybody. We were at the park and a child got lost and we couldn't even help him because he wouldn't speak to us. So my daughter had to go run and find parents, and we just kind of tried to watch the child until we found the parent. But the child was too afraid to talk to anybody. So we need to find
The balance of
a balance. And it's a big issue, I know, that I just brought out, but we need to get out of fight or flight, and I think that's part of what we both want to do for families. So if you had, again, I know you mentioned a pearl earlier, but what would you really want to convey to families if you had a new mom sitting in front of you, or a mom that's new to a more holistic approach? What would you want to share?
The pearl for new families is really in terms of building on the idea of trusting your instincts, and to just surround yourself with people who are going to support you and raise you up with what your ideals are. And so that could be anything from friends you surround yourself with, but also your provider. And so if you don't feel safe and if you don't feel comfortable, it's important to keep looking. And I know I'm not the right person for everybody, and I'm okay with that. And I really try to help families find the right person because it's a long journey. And to not feel comfortable and safe with someone, that's way too long to be holding hands with someone. And we're talking about your precious family. And so to me, it only makes sense to find the right person who will come alongside you on this journey.
Right. And if you're going to ask for referrals from your friends and family, ask people that share the same values that you do. And not that you can't be open to research and new ideas.
The families that I see, oftentimes they're bringing me research. If their child has a diagnosis of some sort, they know way more about it than, honestly, sometimes I do. To shut them down and say, oh, you don't know because you didn't go to medical school is so silly. In fact, would you share that with me? Would you share this with me? And so that's what I think is important, finding someone who's willing to read what they're reading and then share their opinion of what they read and see how it can be blended.
Right. And it's a give and take, and just to be respectful and open-minded on both sides, from the provider and the parents. Thank you so much, Lyndsey, for being here.
Thank you, Michelle.
Today. I really, really appreciate it.
Always good to see you.
Yes, always, always. And we will be diving deeper into this subject of birth trauma in subsequent podcasts, because I do think it really matters. It matters how a mother is treated during her pregnancy, and it matters how you and your mother, or you and your child, were treated in your most vulnerable moments. If you would like to connect with Dr. Lyndsey Sutherland, then you can find her on Facebook at Lyndsey Sutherland, DNP, ARNP, or you can reach out to her at lyndseysutherland.com. And I just want to tell you, thank you so much for listening. I really appreciate it, and so do my guests. We want to uplift you and inspire you and encourage you and remind you, because this has been a recurring theme with all the guests, to trust your inner wisdom, to take time to care for yourself as a parent, and to remember that you know your baby better than anyone. And if you feel inspired, please subscribe, rate, and leave a review for the show, because that helps us to reach more families. Thank you again.
For more great conversations like these, or to find out more information and access Michelle's library of amazing guests, go to birtheaseservices.com/podcast. For more information on the Birth Ease method, Michelle's classes, meditations, and other services, go to birtheaseservices.com.